Morning, everybody, or good evening to you.
Morning.
Oh, hello. Okay, we're moving on now to the last part of the assignment, and today we're going to talk about evaluation. Okay, so we've talked a little bit about preparing and building a health promotion campaign, and we talked a little bit about how you plan it. And you're going to do a presentation for your idea of planning a health promotion campaign. Okay, so the last thing, when you've done a campaign, when anyone does a campaign of any size or shape, the most important thing they have to do at the end is evaluate it. They need to think about how well it went, what the sort of outcomes were, if anything has changed because of it or is going to change. Sometimes it's all a little bit in the future, so you can maybe try and make some predictions from what people say to you. But also the other important thing is to learn from what you've created. Would you do it differently if you did it again? What could be better, or what additional sort of campaign, how would you develop the campaign for the future? What would you do in a year's time? Would you do anything else? Would you be looking at another aspect, that sort of thing? The evaluation is really, really important. And there are also some processes that you need to do. I'm just going to pull some slides up. Okay. So we need to think really, what I'm going to talk to you about is how any campaign gets evaluated, some of the important points of evaluation. Bearing in mind that for your assignment, you are going to have to do your own evaluation of the piece of work that you've created as well, your campaign, your plan. You are not probably going to be able to do all the evaluation in depth, because a lot of health promotion campaigns are, going across thousands of people or hundreds of people. Your campaign won't, it'll be a lot smaller. But what I want you to do is take some elements from the evaluation that we look at today and use it to evaluate your own plan. And as you can see in the task that talks about evaluation, you will need to have some background to it. So to have some added depth to your explanation, you'll need to talk about the evaluation I talk about today, and then to say what sort of elements of this evaluation you're going to use you've used to evaluate yours. So yours will be a sort of probably a scaled down version, but you will need to take some of the ideas. So let's have a look really about evaluation and what its purpose is. Okay, so what's the links between your program plan and evaluation? Well, when you put your plan together, you have to have a goal or an objective. What are you doing? Are you just aiming to prove something? Are you aiming to change something? Are you just aiming to educate people with something? So, what is the goal? And what are the objectives? Okay, so the goal is, when we look at our goals, we evaluate the outcomes. Okay, so the goal can be sort of fairly, a large thing, it could be that the outcome of your evaluation is more people are aware of the dangers of smoking, and you know why it's a good idea to reduce or stop smoking. So that's the outcome that you're probably looking for, say, for example, with a smoking campaign. The objective is measured by impact. So you'd have to actually prove there what the impact is. So if your objective is to get out of the 10 people that you talk to, 2 of them have given up smoking within the next month, or have started the process of giving up smoking, you know, they possibly won't do it in a month, but say they've actually started on a regime of giving up smoking, that's an objective, that's a smaller objective, and that would be measured by what is known as an impact evaluation. So you will look at the impact that your session had on them changing their behavior or deciding to start changing their behavior. Okay. And the third evaluation that you look at is how well things went. As I said, you'd be looking at, you know, did that group work? Did the room work? Did the timings that you gave to things work? All those sorts of things about how well things worked. Did people respond to you well when you sent out questionnaires? Did you get a good amount back, or did you not get any back? So that's your process evaluation. So you see there are 3 aspects of the evaluation that you will need to show, and you will need to do this in your assignment. They may have very, very small goals and objectives, but that's okay. But you'll be looking at the outcome, the impact. So outcome is about, you know, educating or changing attitudes maybe, or making people understand the problems. Impact is whether this actually affects their behavior. Okay, and the process evaluation is, did what you do work, or would you have done it slightly differently in the future? Okay, so that gives you your areas to focus on. So let's think about impacts and outcomes. We define impact as that intermediate effect that the programs have. So things, you know, fairly short term. What's happened in the short term? What have people done in the next couple of weeks after maybe your program, okay, or your education session, if that's what you're using. And the outcome is the long term, which is very sustained behavior changes or research later on that shows that people's quality of life has improved. Now, that's not something that you're really going to be able to do as part of this assignment, because we're not going to come back together in a year's time and you look at it, but you might want to write about it, what you would do as a future thing to find out what the outcome was. Yeah, we'll talk about that a little bit more. Process evaluation, as I said, is what bits worked, covers all parts of your process plan. Your process plan is what you're going to present to me on Thursday. Okay, so it's like, did it reach all the people you wanted? Did everybody who you asked attended? Those sorts of things. What went wrong? Did people not answer you, like I said, or did people not like the room you used, or did the room not work for you? Those sorts of things. Maybe have a think about equalities issues. Did you get the right sort of people in, or did you get all the same people in? Were you able to get the mix of people that you wanted, different backgrounds, different needs, different abilities, sometimes different cultural divides? So, you know, were you able to pick up differentiation? Were you able to look at diversity? Okay. Or were you looking at a very specific group for a very specific reason, which would preclude you from bringing in different types of people? Okay. And if that's so, that's acceptable, as long as you explain it, like why, you know, who you've chosen, why, what the idea is. Have you chosen a group of women of the same age for a particular reason? you can't just do it because, but you need to have a sort of reason for why. If you've chosen similar groups, like, or single sex groups, single age groups, you need to sort of explain why, really, what's the process. Data collection. So now normally in a very large health promotion campaign, there would be a steering group. There would be a group of people, a sort of committee who discuss it, you know, because sometimes there's quite a lot of money involved. They're going out to lots of people. Some of the NHS, Public Health England ones, go out to thousands of people. So they're actually quite large projects and need quite a bit of guidance and support. So the sort of things you would normally keep is any minutes of your advisory group groups as you had them. Any people where you engaged, you might have got different people to go out and do bits of work for you. So you'd have all the records of that. Your actual action plan, and if you did any if it was a very long action plan, you might have to do little progress reports against different levels of it. Now, yours isn't going to be a big plan. Yours isn't going to be a long plan. But like I said, you can certainly address some of these issues, but say because yours is quite small, you know, you don't have an advisory group, or you might just work with another friend or something on it if you want. And your action plans need to identify, again, if it's a very long and large piece of work, you might stop and evaluate things at different points. You might not just evaluate things at the end, but you might evaluate it after certain things have happened. So a lot of this is sort of very clearly, it would normally be documented in, you know, graphs and charts and plans, all clearly written out so people know when things are going to happen, what happens when. But you may do some other qualitative methods. So like having little surveys at the end, or maybe if you've only got a small group, you might just want to go and interview people, how they felt about it afterwards. Any sort of, you might just get some feedback from people, how they felt about being in the group. That would help you with your evaluation. You might not ask everybody, you might just randomly pick a few people. Or you might just do it as a focus group, which is have a set of questions and get everybody who attended together again, or you know, maybe a week later, or send stuff out to them. But a focus group is different because a questionnaire, they can just only answer your set questions, and depending on how, you know, how much space you give for them to say. But the focus groups, you get a lot, you know, you get much more interactive discussion. So it really depends on the sort of information you're looking for. So with the questionnaires, you can get clear data. You can get 8 out of 10 people like this, 8 out of 10 people said yes, 8 out of 10 people said no. But with the focus groups, you get more people sort of sharing their views and opinions, which may be different. So that adds what we call the qualitative effect. And when we evaluate something, we like to have a match of the two. We like to have a bit of data, statistics, but we like to some qualitative stuff from interviews as well. So you just kept people saying, well, I quite liked that bit of the teaching because I thought it really, you know, made me think about things. I like the pictures that we used or something like that. The impact assessment, as I said, looks at short and medium term effects. So it's sort of finding out if maybe afterwards somebody says, yes, actually, I feel a bit differently about smoking now, or yes, I found this very upsetting. So it made me think, yeah, I'm going to start this week, you know. So those are the sorts of things you'd be looking at. These are your sort of more short term. And then later on, you'd find out maybe if they actually managed to achieve it. So you've got a sort of a longer term there. The sort of methods that we use is you can compare the views of a group who has been through your session with the views of a group who hasn't been through your session. So if it's about learning to manage diabetes, say, you can get the views afterwards, you know, finding out what their understanding of diabetes and the things they need to do to manage it is. And then you could get a group of people who maybe have diabetes but haven't been through any educational sessions and see how they differ. You know, do one group know more than the other? You know, did your session make a difference in that sense? Or did that group just find out the information anyway? And if so, you might think, well, maybe that session isn't the right sort of session. Okay. So that's one way to do it. And when that is known as a control group, when you're doing sort of scientific research, control group is a group that has had no intervention. Okay. So that's one of the things. If you were looking at bigger statistics, you can take sort of stuff from your local region or your state or even a countrywide one. You can just get average statistics of them. So average people who smoke, average people who manage their diabetes will, and then sort of compare that to what your little group's saying. So if you're saying that with you know, across the state, I don't know, 50% of people interviewed don't really know how to manage their diabetes properly. But if you could say that after doing your session, 70% of your group said that they felt they did know how to manage it. So you could compare those two statistics. So you need to find something to work with. And as I said, you could either start with a national statistic or a regional statistic, or you can just start with another group of 10 people that you saw. So you can take it in different ways, really. You use data that probably already exists from your public health provider. So that'll be on the website somewhere, you know, think about it, you should be able to find it. You can also compare countries to countries if you want, and then, you know, use that as a background for your work. Health equalities. So a larger, you know, normally when we're doing these sort of programs, we have a look to see where they're having an impact on populations with the greatest health inequalities. And that takes some finding, but again, we usually have statistics. Most countries already look at those statistics. So they're usually available somewhere. You can usually Google them. And it's quite important to measure those sort of demographics and put them in where it's relevant into your assignment, really. So you need to try and find populations that have the greatest health inequalities when you're looking at that, so that you know what's going on. So the sorts of things you might be looking at is, you know, the sort of socioeconomic position, you know, are they wealthy, are they poor? How does that differ? So you might do some background on the people that are coming to your group as well. You need to be a little bit subtle about that, but then you might just give them a questionnaire to answer. But, you know, you've got to think about putting your questions in a way that don't offend people about how much they earn and that. But we get these questionnaires all the time with these little bits at the back about people's ethnicity, so, you know, their sort of class and status and that. So you just need to find a way of doing it sort of subtly. So some of the most inequalities come around because of people's socioeconomic positions. You need to think about that. Ethnic background, as I said. I've got rural residents in here because when it comes to health equalities, it really, really seems to matter, not just in this country, but across the world. Access to health education and health information and health intervention is much easier in the bigger cities than it is in the rural areas. So you might want to put that into your evaluation as well. Like if you're in the country at the moment you know, you need to say, you know, these people can't get access to GPs that easily and that. So that might be part of your background. And also the language that they speak. If I was doing it here, I would identify, you know, in the local population, how many didn't have, you know, what the statistics, people who don't have English as their first language. I'd look at my group as well, how many people don't have English as their first language. So here I've put, because a lot of you are in Malaysia, I've put people who are, you know, in your group. Are they going to be from a non-Malay speaking, or are you looking at a sort of maybe a refugee group who are another language, so Malay isn't their first language? And that's quite useful too, because you can identify the fact that a lot of public health information is often based around the language of the country. And if you're a minority group who that isn't your first language, you might not always pick up on some things. So it gives a bit of direction. And if you find that a lot of the people who aren't picking up public health English is maybe, and they're saying it's because they can't find things in their own languages, well, that's something that for health promoters to think about in the future, and that's something for you to flag up. Might even tell you that you should have done your questionnaire in several different languages. So have a think about that as well, you know. So these are just looking as part of your evaluation. You don't have to get it perfect. You will have these things that you didn't think of, or that came out in discussion. That's not a problem. You don't have to do it right this time. Remember, this is a learning process. You are not health promotion experts. A lot of them do degrees, you know, in that subject. So you are not going to be able to do it all right. So if you do sort of make mistakes about you maybe not putting your questionnaires in the right language or not putting it in the right way, don't worry about it, because as long as you pick it up in your evaluation, and I know that you've learned from it, that's all I need at this level 3, okay? That you have an understanding of it and that you've learned from it, okay? So please don't worry, and please don't sort of think, oh my God, I've got to stop and do it all over again because there's bits I've missed. That's, you know, the learning is actually as important as of understanding how to do it in the first place, okay? So data collection, you need to identify what sort of tasks have you got as part of your program, who's going to do them, when, and if you need any resources. You might not need, you just might need paper and pens and pencils, fine, okay? But if there are any resources, if you're going to send out questionnaires to people, how are you going to do that? What resources do you need to do that? You might be able to send them out by email or social media, fine, that doesn't really have a cost. But if you do need to print something, you need to think about, you know, how you're going to manage those costs, really. So have a little think about that. There's also a big issue, just a warning with surveys, especially if they're paper and pencil surveys, that, you know, low responses are really, really common. So, and that can really affect your results, especially if you don't have a massive group anyway. So think about how you're going to overcome those. What I would suggest is, rather than give people a paper and pencil survey to take away, because they frequently don't send it back, or they don't know where to send it back, or if it means they've got to walk and bring it back to you, that never happens. Get them to do it in the session and then hand it back to you before they leave, if you're going to do something like that. And that's one of the weaknesses of, you know, sending out. If you use social media, you can actually obviously send it out to a much wider amount of people if you want information, but you could also just not get it back as well. So have a little think about what you want to do, and think about how you're going to overcome that. So lots to think about, really. So then we need to look at data analysis, and that's sort of identifying and summarizing what your key findings are. Now, you might gather your data in a variety of ways. If you're doing a face-to-face group, you might get some qualitative data, you know, just by questions and answers in the session itself. And as I said, you might follow it up with the survey. You've then got to pull all that information together and summarize what your key findings are and what sort of themes you find in the raw data. Now, yours, as I said, you're only going to be dealing with small groups, so you should be able to manage to add it all up yourself. But if you think about when we do health promotion, we might be sending up to thousands of people. There's quite a lot of data to be managed, and you know, you tend to need to use software programs and that to help you. You know, some sort of data spreadsheets for you to actually put the information in. So don't make it too complex for you to bring the information back together. So have some questions that can give you some yes no answers, but don't have all your questions yes no, otherwise you'll only get quantitative data. Okay, and you need qualitative data. This is the bit where I say where you talk to people, and you might just randomly pick a handful of people to do one-to-one interviews with, or you might just have the whole group together as a focus group and get your feedback then before they go on. That's quite an easy one to do it. Okay, and the qualitative data, it's going to be lots of random ideas. So if you are doing something like that, you need someone else to sort of jot down all the things that people are saying, because if you're sort of managing the discussion, it's very hard for you to write ideas, write notes down and manage the discussion at the same time. What you could do is, if people were happy, you could just record that bit and just say, I'm just going to put my phone on, I'm just going to record people's feedback, really. And then you can listen to it over and over again and gather your information. And the important thing is like putting your data into sort of categories. So can you think of any examples of categories that you might put your data into? Anybody got any ideas? Not sure? Well, the categories you could sort of think of is, you know, people who say they're going to change their lifestyle, or oh, hello, someone's come up with an idea. Not sure. Okay, somebody, you know, so you can have a few categories, what you're looking for in your qualitative data. So when they're chatting, because you do need to try and guide the conversation in a certain way. So you could be looking at categories like, I need more information. So how many people come up with sort of in their conversation saying, yes, this is helpful, but I need to know more. Yes, this has given me enough, so now I'm going to change my behavior. Another category you might be looking for is, okay, thanks for the information, but I'm not going to change my behavior. Okay, so you'll have these to the side. Once people give all their information, remember your questions, you're looking for sort of answers for some of those categories as well, without saying it outright. You know, you could sort of think about, you know, is there more information you would like? Is anybody like more information, or have people found this information good enough to make decisions? What do people think? You know, so you sort of put it out to them like that. And like, oh, can I ask you, is there more you need to know about this subject? Do you feel confident that you know enough about this subject? That sort of thing. Other things like that. So one other category you might be looking at is, just for your own information, is how many women felt it was they were going to change their behavior, how many men felt they were going to change their behavior. So you could just get an idea, make a note, you know, with the females that said it and the males that said it and that sort of thing. So really, like I said, it's very difficult for you to take notes when you're running a focus group or a feedback group. So if you either get someone else to do it, or ideally record it, so you could spend a bit of time listening to it, and then you could put some of these answers into your categories. But when you report on it, you can make your category, you can put your category in your report, and then you can write the information underneath. And maybe this is one of the occasions when you might quote one of the people, just to sort of give people an example of the sort of things that people have said. Because this is qualitative data, it's not about numbers. But you could also say, well, actually, out of my group, at least 50%, at least half of them felt this way, and only a couple of them felt this way. So you don't always have to put it into statistics. Quantitative data, which we're looking at here, is a statistical analysis. So this is when you will do surveys, or you could give them a survey at the end of their focus group as well. And then you can start sort of putting numbers together, data. So if you have a look at some of my examples of quantitative data, 4 cakes and 3 muffins in the basket. So they were counted, okay? A glass of fizzy drink has 97.5 calories. So that's something that can be measured. So the whole point about your quantitative data is it can be measured, okay? And you could also measure it, as I said, against some regional information. So if they've got regional information that, I don't know, 29% of the people over 60 have given up smoking in the last year. And then you can compare it to, say, 50% of the people of your group said they were giving up smoking. That's actually higher than the regional amount of that age group, things like that. So you can bring in other data and do a comparison. You can't really do that with the qualitative data, where people that I was talking about just before, where people are giving their views and opinions and their feelings. But that is really important to enhance the work that you're doing. It's these sort of views and feelings that sort of colour, fill out your report, really fill out your evaluation. You don't have to prove them, because it's just what people say and how they feel. But added together with the data, you get quite a nice rounded evaluation. And we're gonna focus firstly on task 4. Okay. If you want to see the assignment, it's been up on Google Classroom for a while, so you can always check on it. I'm going to bring it up at the end, but this, I've copied this from it, so you don't really need to sort of worry it, okay? But we do have it. So we're looking at task 4 first, because that's the bit you have to hand in first. Okay. Task 4 is develop a health promotion event and analyze its effectiveness. Okay. 4.1 is any promotional material. So it will be a poster, a video, or a leaflet. Okay. You can upload it to Google Classroom and show it at the beginning of your presentation. So this is, as I said, a poster, a video, or a leaflet that you've created to go with your campaign. Okay. And a lot of people did a poster just, especially those who did an educational session, they did a poster just telling people, where it was happening, where to go, and, something eye-catching about the information. So you'll show that first, and you can take that down. It's not covered by the word count, okay? And you can get some feedback on it as well, so you can make changes to it. because you don't have to upload it until the 20th. You can upload it before if you want, I don't mind. So if someone gives you, I mean, a lot of people found it quite useful because they put their posters up. A lot of people did posters, as I said. A couple of people did videos, and the videos were really good actually. But a lot of people did posters, and a lot of people just, you know, gave them a bit of feedback, like a color didn't work or the pictures weren't that clear or something. So it gave them a chance to change it if they wanted to. And that was quite useful because it might have improved their grade for them. 4.2 is an oral presentation of your process. Remember, it's your plan and the process. You need to explain what you're going to do, or what you did do if you've already done it. You may not have done it yet, that's okay. What you're going to do, why you're doing it, what the impact and outcomes you're hoping for, really, and then telling me about the process. So sort of timetable you've got, the hours you've set in for it, how many people, how did you pick your audience group, where you're getting them from, where are you going to do this? Quite a lot of detail, really. Okay. Okay, so your written evaluation, which we've talked about a little bit today, I've given you some ideas and guidelines about how to do your evaluation. That will be task 4 when you write up the rest of the assignment, okay? And the idea is to look at the effects of the campaign and any potential barriers, anything that maybe didn't work well, or you could say what did work well, but what didn't work well, and what you would change in the future, okay? And, you know, some of the things we've talked about. So I want a good evaluation that has a bit of depth to it, really, okay? Okay, let's go on to talk about the rest of the assignment then. So now we're going back to task 1. All the rest of the assignment is written and handed in together. So you have 300 words here to write task 1. And that's the overview of that is examining how public health policy is developed to improve the health of the population. There's 3 criteria that you need to address, okay? You can put the criteria as headings if you want, I don't mind, or you can just number it 1.1 and then write a paragraph, okay? But bear in mind, you've got 300 words to get over those 3 criteria. You could write 100 words to each criteria. You don't have to though. So you can write a little bit less for one and a little bit more for the others if you feel you've got a bit more to say, okay? Most important thing is this is academic essay level. So you will not write in bullet points, okay? You will write in full rounded sentences. You will make a paragraph that relates to itself, okay? So proper academic writing here. And what you need to do is to think back to the slides, think back to some of the sessions, use some of the information there. But if you want higher grades, you need to bring in a little bit of research from somewhere else. So if you're looking at the process for developing a public health policy, I have given you that process, but you could have a look at one of the references and, you know, see if you can add a little bit of depth to it if you want. So I always give you the overview, but it's up to you to add the depth because it's the depth that pushes your grade up. Okay. So the first one is what is the process? So you need just to explain. If you recall, I did something about a policy circle. If you can remember that, the policy cycle. So that's really quite important. So if you look at the policy cycle and think about the different stages of it and explain that to me, that will be useful. You could I don't mind you putting a graphic in, or you can put charts in as well. But the word count still has to go around them. Okay. So section 2 is identify the potential group. So if you remember back to the first week, we looked at the different groups of people who can influence public health policy. And remember, they were sort of people like politicians or experts in the field, or sort of pressure groups who sort of work in one area. So have a look back at that, and then see if you can add anything from your research. Okay. And then 1.3, how does the government monitor the health of the nation? We looked at that last week. So we looked at monitoring the health, and we looked at some of the common statistics that are used pretty much internationally. So you can bring those in, really. You can refer to the UK government, sort of regular Public Health England. You can refer to some statistics you bring in from Malaysia, or both, a little bit of both. Will probably give it the additional depth if you want. Okay, so as I said, to help you think it out, do look back at your slides. You don't always have to watch the whole thing, but you just using the slides can sort of help you. But you need to put some of your own research in. If you don't put additional research in, you'll probably get a pass, but you know, you'll just get a pass. To show that you've read around the subject, you need to put other little bit more information in. Like, I'm not allowed to give you everything, because otherwise there's nowhere for you to go to get better grades. Okay, task 2. So task 2 is 200 words. It's 2 criteria. Again, you can split it up. Examine the factors that can affect health in the population. So again, go back to some of the things we talked about. And you can bring in some research from either the UK, what are the big factors affecting health in the UK? Or again, you can bring Malaysia, which is the country you're living in now, or Indonesia, those of you who may be in Indonesia. It's quite good if you give me a little bit of both. Okay, so I'm looking at the UK and Malaysia, so, and you can pick on a handful. So it'd be quite interesting, because if Malaysia may have some health issues that are not issues in the UK, and the other way around. So obviously you can't give me all the health issues. You're going to have to just choose a couple. Okay, but you want to choose ones that are big issues, really. Don't choose one that's a health issue but quite rare and only for a small group of people. You want to sort of choose one that's a big national issue, really. Okay, and then maybe give me a few of the statistics. Okay, and the second part is, what are the benefits? Now, we did this in a class group. Remember your group discussion. Look back at it. We did this last week. The potential benefits. Why is it useful, or why is it good or valuable to improve the health across the nation? And you told me things like, people going to work, economic, raising up the economic viability of the country with profits, and people actually going to work, doing their jobs and paying. So those sorts of things are important. People contributing in different ways to the ongoing part of the country. So a lot of it is socio-economic, but still, and it also, if people are very healthy, then you can reduce the amount of money you can spend on the health system, and spend it on other things as well. So identify. And as I said, you will get higher grades if you include information that I didn't give you, as long as it's accurate and appropriate. And to do that, you're going to need to put references in. I'm going to talk about that a little bit in a minute. So that's task 2. Okay, task 3. Task 3 is how health promotion can influence individuals to adopt healthy lifestyle. So this is a little bit more complex. You need to go back to pretty much one of our early sessions. 3.1, you need to evaluate 2 models commonly used in health promotion. Do not get these mixed up. People have done this before. Models and approaches. They were 2 separate sessions. So go back and have a look at the models then. Obviously, people aren't that sure. So have a look at the models and you need to evaluate them. Okay, so I think I gave you 3 models. And when we say evaluate, do not just describe 2 models. And evaluate means you have to compare them. You're doing a compare and a contrast. And you have to look at the strengths and weaknesses of each of those models. Have you ever done so? Have you done something like that before? Done that? No, not really. Okay. Well, let's see how you go the first time. But you need to start practicing that, because with the level 3, you do a lot of this sort of evaluation. So you will compare 2 models. Why does this model seem better than the other? Okay. And you can't just say it, you've got to sort of come up with your reasoning as well, really. That's the important thing. Okay, so you might need to get a little practice in that, and maybe this session will be your first practice. So, you know, that's sort of okay, really. And maybe you won't do it quite so well this time, but I will give you, you know, in my feedback when I mark your assignment, then I'll mention it. So approaches were things like the educational approach, the fear approach, the behavioral change approach, okay? And with that one, you don't need to just pick 2 and compare them. You just need to discuss a few of the approaches, okay? So I would suggest you come up with 2 or 3, as many as you can get in, really, in the word count that you've got. Now, number 3.2 is just discuss. So I'm not asking you to compare like the one above. I'm just asking you to tell me about them, okay? So that's a sort of different thing, really. When it says evaluate, you've got to do a comparison. You've got to talk about what the strengths and weaknesses of each model is. Where it just says discuss, you just need to explain them. Okay. Okay, well, that's sort of good luck, really. So that's the main thing I say. I'm going to show you how the marking works as well. The important thing is, don't get too stressed. Spread out your time, okay? You've been given quite a long time to do this one. We don't always give quite as long as you've got, so make the most of it, really. I think he gave it to you because he knew that you were having to focus on doing the process first and that. Okay, so if you look in your assignment, you will have this page at the end of your assignment, okay? The assignment just really goes through all the stuff that I've talked through, all the questions and criteria, okay? And then at the end, you'll see this. And this is my marking guideline. So I have 5 criteria that I mark. So each one of these criteria gets a score. Okay, so the first one is content. And this is how much the content that you've written actually matches up with the criteria. So how well have you answered the questions almost, okay? And within that, how much evaluation is there? How much more evaluation is there? Or have you just done the basic concepts? Okay. And you could see, if you have a look, again, I have some guidelines. So I have some areas where your numbers have to fall within. Okay. So if you look at, to get a distinction, you need extensive evaluation, lots and some original thinking. Excellent is comprehensive evaluation. Good is adequate with some of the key ideas. Okay. Proficient is you've just got some of the main points, and then it sort of goes down a bit lower. Marginal is largely incomplete. You didn't do the whole description. And unacceptable would sort of speaks for itself, really, I think. So content, you've got content. The second one is application of theory and literature. And this is where your researching and your referencing comes in. Not only do you have to bring it in here, but you have to apply it properly. So you can't just stick a reference in there that you know, has not really got to do with answering the question. Okay, just because you think it's useful. It's got to be answering the question as well. So this is where I assess the research you've done and how well you've used it. And as you can see, that sort of goes down from no evidence. So if you don't put any research in, you're going to be down in these two ends, marginal or unacceptable. Basic is where you've done a little bit, but you've just put a little bit in now and then, but not consistently. Okay. Proficient is when it's adequate, you sort of referred to it. And then appropriate. And the only way I'm going to know that is if you've put some citations in, because otherwise, for all I know, you could be making it up, really. And I'm not going to be interested in looking that up. So the next criteria is knowledge and understanding. And this is you demonstrating your knowledge. And it's really by the quality of the explanation that you give and the examples that you give, really. Okay. So as you can see, if it's distinguished, you've shown a great deal of understanding. You've gone beyond the question, and you can go beyond the question as long as what you add is still relevant. Okay. Excellent is when you've shown a comprehensive knowledge and good depth. The depth is when you come out with stuff and it links to the bit of research. Added depth means you've put in more than I've told you. Okay. More than I've told you. So if you put in more than I told you, you put in your own work, your own research, you're going to be up in the top 2 grades. Okay. The fourth one is presentation and writing skills. Sort of speaks for itself, really. It does pick up your spelling. It does pick up your grammar mistakes, definitely. Okay. But I have a level of leniency because I know none of you are writing in English, which isn't your first language. So I am not expecting you to write it as well as an English A-level student, okay, or a British A-level student. But I do expect a certain level because you still have to meet the requirements of level 3. So, you know, level 3 is A-level standard, but it doesn't have to be top A-level standard in your English, but it needs to be of a good standard. You need to make sense, basically. If there are small spelling mistakes, I will overlook them. Okay. If there are lots of spelling mistakes, that means I don't quite understand what you've written. That's a different thing. If I can't understand it, I can't mark it. So, you know, you will go down in the lower end, really. You can see, like, the middle one is if the presentation is orderly, and then minor errors of mechanics and syntax, you'll go down. If you go to this one, it may interfere with meaning, that will drop you down. If this one, you can have a few errors, but which don't inhibit the meaning. So I'm allowed to sort of give you that, and you won't lose too much, really. So to get the top 2, you have to be 3 from errors. Although, as I said, the odd 1 or 2 spellos I tend to overlook. Okay. It's not just about your written English as well, or that is a large part of it. It's about writing in the right style. Okay. It's not bullet points. All the sentences have to, you have to make proper sentences. And they need to be paragraphs as well. So remember, you're writing this like an essay, even though you have small questions to answer. They're perfectly formed paragraphs in their own right. Okay, they're not just jot down ideas. So you need to have some logical coherence. Now, to be honest, if you follow the criteria, the way it's laid out, you should remain fairly logical. Some people get a bit lost in their explanations and end up talking about something else and then coming back to another thing and that, and then bringing something else out of the blue. If you do that, you'll get marks, but you'll lose some marks just from the logic of how you put it together. So it's got to make sense, really, to me. And if you don't make sense, I'll sort of come back to you and say you lost some clarity here. I won't fail you on it, but what you will do is you'll lose some marks. Where there's an oral presentation, that is a large part of the presentation mark. Where some other of the units don't have oral presentations, all the mark will be just on what you've written in the assignment. Okay, so you stand a chance to sort of gain or lose marks there. So one of the most important things I would say to people is, before you hand it in, go over, check, because sometimes people do things very quickly, which is fine, but then go back over it, make sure it makes sense to you. And if you're not sure, read it out to somebody, because it's a shame to lose marks on things that you're just not sure about. Okay. And very often presentation can be improved quite easily with people taking time over their work, really. And as you can see, the last mark is referencing, which is why it's important to know how to do it properly. If you don't know how to do it properly, I can't give you anything in the top 3 grade. I can only give you the bottom 4, okay, or from the middle down. You can only get adequate, really, and you will probably get, if you don't know how to cite things and if you don't know how to do it, you're going to get in the bottom 3. And it's terrible that a lot of people, because they don't try to check things up, end up losing big marks on referencing. Okay, there's a referencing guide attached to this assignment, so even if you can't make it to the class, and I would love it if you did, because I'd like to see you practicing your paraphrasing, because the guide doesn't help you with paraphrasing. There is a guide that tells you how to lay out a reference, at least, and you'll see it if you go into Google Classroom, where this assignment is, it's attached there as well. It's another attachment. So please make use of that. Okay. So what happens is I've got 5 different areas. And as you can see, I've got between 0 and 100, really, I can mark, okay, for each one. What I then do is I take the totals I've given, each 5, and I add them up. So say I give 60 for one, 70 for another, 55 for another, 45 for another, 65 for another. I will add them up and divide them by 5, and that gives you your overall grade mark. So along with some of my verbal feedback, I'll mark in Google Classroom, so you'll see comments in the paragraphs if you go in and have a look. Then there'll be an overall comments with your grades, showing you what I gave you for each different area, and then you'll get your overall number and you'll get an overall grade mark. Okay, and that will go to the verifier, and they just sort of check that I've been consistent with my grading. Sometimes they might tweak it a little bit, but they often don't really, but they can do. Okay, so as soon as I've marked it in Google Classroom, which will be, I have, and then you'll see it straight away because I'll mark it all on Google Classroom and it will get returned to you with your grade. Okay, so you'll know. After that, there's a little report which just sort of summarizes, your grades and what I gave you for the different areas, and that will go to your tutors at your college as well, and they should pass it on to you. They usually do. They record it all or take copies of it and then pass it on to you. So for each assignment you get, you'll have the basic marks in Google Classroom, and you'll be able to look at those whenever you want. And then I'll do a summary report for each unit as well, and you'll have those in time. So you'll have a summary report to keep for each of the units that you do. You'll know where you've done well and where you haven't done well, really. Good. You'll see how it comes out anyway when I do it. So the most important thing really is just to wait for the first one. When I've marked it, you'll get an idea of how it works, really. Okay, I'm going to say goodbye to you now. Bye.